Good morning, dear students. Today we'll discuss two important topics. One is pathological calcification, and second one is intracellular accumulation. Okay. Now, what is pathological calcification? Abnormal deposition of calcium salts along with small amount of iron, magnesium, and other mineral salts, other than bone and teeth. There are two types of pathological calcification. One is dystrophic calcification, another one is metastatic calcification. Now, what is dystrophic calcification? Accumulation of calcium on the dead and dying tissue is called as dystrophic calcification. Here, the serum calcium will be normal. So, these are some of the examples of dystrophic calcification. So, accumulation of calcium on necrotic tissue, atheromas, damaged heart valves, psammoma bodies, and asbestos bodies. Macroscopically, dystrophic calcification, they appear fine, white granules felt as gritty deposits. Microscopically, they look basophilic, amorphous, granular, or clumped appearance. It can be intracellular or extracellular. This is a gross morphology of the aortic valve. You can see gritty white granular deposits in the valve, causing the lesion as stenotic. This is the microscopy of malignant lesion. You can see this dystrophic calcification in the necrotic tissue. This is one asbestos bodies with accumulation of calcium on it with some foreign body chain. This is a psammoma body. It's a laminated calcium accumulation seen in papillary carcinoma of thyroid. So what is the pathogenesis of dystrophic calcification? There are two pathways, initiation and propagation. Initially, this is the cell membrane, it's a bilipid layer. Initially, calcium accumulates with the help of phosphatase enzyme. The phosphate is released to form the calcium phosphate crystals, hence forming this micelles accumulating, causing a dystrophic calcification. Coming to metastatic calcification, here the pathogenesis is either there is increased secretion of parathormone causing increased calcium levels in the blood, or destruction of the bone tissue, hence releasing the calcium into the blood, accelerated bone turnover, and vitamin D related disorders. There's another condition where it's called as milk alkali syndrome, where increased ingestion of antacids can cause this increased calcium levels in the blood. As you all know, the normal calcium levels is 9 to 11 milligram per deciliter. So here it is more than 11, hence accumulating in normal organs or normal tissues. Whereas in dystrophic calcification, the calcium accumulation on dead tissues and necrotic tissues, here in metastatic calcification, they accumulate in normal tissues. What is the morphology? So these calcium accumulation are seen in gastric mucosa, lung and kidney. Massive involvement of the lung can cause respiratory deficits. In kidney accumulation, it is called as nephrocalcinosis. This is a microphotograph of the alveoli where you can see the calcium deposition in the septa, which is marked by arrow. Now coming to intracellular accumulation. So what is this intracellular accumulation? Accumulation of certain normal constants or sometimes abnormal constants intracellularly during this reversible cell injury is called as intracellular accumulation. Things can accumulate. This is a image of a tattoo. It's one of the pigment accumulation in the skin. So these are the different mechanism how the accumulation of abnormal substances can happen. Either there may be abnormal metabolism, defect in protein folding transport, or lack of enzymes, or ingestion of indigestible materials. So what all things can accumulate? Either fat, proteins, carbohydrates, or water. These are the normal endogenous substance. Sometimes an abnormal endogenous substance in lysosome storage disorders and alpha-1 antitrypsin deficiency, and sometimes pigments. Pigments can be exogenous or endogenous. Now coming to fat. You know the liver is the main organ for fat metabolism. So the excess fat accumulation is seen in the liver in certain condition where there is abnormal fat metabolism. So these are some of the conditions where the accumulation of fat is also called as steatosis. So there will be excessive entry of free fatty acids into the liver, that is seen in starvation, or decreased fatty acid oxidation, which is seen in anoxia, increased esterification of fatty acids to triglycerides, which is seen in alcohol, or decreased apoprotein synthesis, which is seen in protein malnutrition and carbon tetrachloride poisoning. Sometimes impaired lipoprotein secretions. There may be stones which is blocking the secretion bile into the second part of the duodenum. So what is the morphology of the fatty liver? Grossly, the liver is enlarged. The weight of the organ liver is increased from 1.5 kgs. It may go to 2 kgs or 3 kgs. It becomes bright yellow and very greasy. Microscopically, fatty livers you see microvesicles, macrovesicles, sometimes fatty cysts. The overall architecture of the liver is lost. This is the gross appearance of fatty liver. In the right side, you can see yellowish appearance, very glazy and shiny appearance. The organ is enlarged, whereas left side you can see the normal liver. This is the normal histology of the liver. Microscopy of fatty liver, you can see these microvesicles, macrovesicles, and some fatty cysts. So what are these fatty cysts? The macrovesicle structures together to form these cyst-like structures. So how do you confirm this is fat? There are some special stains for fat which is done in frozen tissue sections like Sudan 4 and oil red roux. The fat brick red in color. Fatty change can also be seen in heart, the skeletal muscles. Sometimes fat accumulates in the vessels, which is in the tunica intima. You should remember atherosclerosis, which is also a type of fat accumulation. Sometimes fatty accumulation can be seen near the joints, which is also called xanthomas. This is one example of cholesterolosis. So what is cholesterolosis? Accumulation of fat in the gallbladder mucosa. So you can see these foamy cells, which are nothing but macrophages engulfing the fat cells. Next, protein accumulation. Normally, sometimes protein can accumulate in the cells, especially in the renal tubular cells, where there is a mild amount of protein needed. The protein can diffuse into the cells. Then another one, normal protein which can accumulate in plasma cells, which are called as Russell bodies. Sometimes defects in the protein folding, defective intercellular transport, like alpha-1 antitrypsin deficiency, toxicity of abnormally folded proteins like Ashmus and amyloidosis. So this is on a microphotograph of the kidney. You can see this pink deposits in the renal epithelial cells, which are nothing but normal proteins. This is a protein accumulation which is homogeneous pink, which is seen in the liver, okay, especially in hepatitis and even in cirrhosis. This is a abnormal protein, which is a specialized protein, which is called as amyloidosis. This is a special stain to pick up this amyloid, which is called as Congo red stain, which stains the amyloid as brick red in. Hyaline is a type of protein. Sometimes it can be seen intracellularly or extracellularly accumulations. Extracellularly, it is seen in old scars and arteries in the kidney, especially in hypertension and diabetes. Next is carbohydrates. It's usually accumulated in the form of glycogen, especially seen in diabetes or glycogen storage disorders. Coming to pigments. Pigments, there are two types, exogenous and endogenous. Exogenous may be anthracosis, which is carbon containing pigment, usually inhaled and accumulated in the lungs. Tattooing is usually the pigment which is external origin, which is accumulated in the skin and subcutaneous tissue. There are four endogenous pigments. One is lipofuscin, melanin, hemosiderin, and bilirubin, which can be accumulated in cells. We'll discuss one by one. So what is lipofuscin pigment? It's a wear and tear pigment. It's brown color, usually seen in heart. So what is this wear and tear pigment, or what is this lipofuscin? Fuscin in Greek is brown. So whenever the heart is the most physically active organ in our body. So certain metabolic end products which are not digested keeps accumulating for over years together. Long years together, so they keep on accumulating in the heart. So the heart of a 90-year-old man will be brown, which is nothing but a lipofuscin pigment, whereas child will be red in color because there will be no lipofuscin pigment. This is a lipofuscin pigment which is accumulating in the heart next to the adjacent to the nucleus. Coming to melanin, it's the only black pigment in our body. This pigment can be accumulated in the skin and sometimes in the mucous membrane. It can be benign pigmental accumulations or in malignancy, especially in melanoma. Hemosiderin is an iron containing pigment. So what is this hemosiderin pigment? Especially seen in bleeding wherever the RBCs are involved, or repeated blood transfusion, especially in thalassemia. As one more condition where there is called as hemochromatosis, where there is increased iron absorption. So this is a golden brown pigment, hemosiderin. Okay. So how do you confirm there is a special stain for iron which is called as Prussian blue or pearl stain? So which stains iron as blue color, that is Prussian blue in color. Coming to bilirubin, which is a yellow pigment which is accumulating in the sclera and the mucous pigment. The clinical condition is called as jaundice. So bilirubin is the end product of heme metabolism. So any hemolytic anemias, it can be even in liver disorders where there is failed metabolism of bilirubin can cause this jaundice. So we'll just summarize. Today we discussed two important things. One is pathological calcification, another one is intracellular accumulation. So what is pathological calcification? Abnormal accumulation of calcium and even some minerals like iron and magnesium in an other than teeth and bone is called as pathological calcification. There are two types. One is dystrophic, another one is metastatic. So what is dystrophic calcification? Accumulation of calcium on dead and dying tissue. What is the example? Seen in aortic valves, in necrotic tissue, and even some of the bodies. The second type is metastatic calcification. Here the serum calcium will be high. In dystrophic the serum calcium is normal, but here the serum calcium is high. So what happens? The accumulation of calcium is seen in the normal tissues, especially in the gastric mucosa, in the lung, and even in the kidney. Now coming to intercellular accumulation. So what all things are accumulated in the cells, especially in type of reversible cell injury? One is fat, carbohydrates, proteins, and even pigments. So fat accumulation is seen in liver. It's called as fatty liver. Is seen in starvation. Is seen in protein energy malnutrition, carbohydrate poisoning, anoxia. So fatty liver is also called as steatosis. The liver is enlarged, becomes yellowish and greasy. Microscopically, you see microvesicles and macrovesicles and sometimes fatty cysts. There are special stains for fat which you should remember: Sudan 4 and oil red O. It stains the fat brick red in color. Now, protein accumulation usually seen in kidneys. It can be diffuse, normal diffuse accumulation, or abnormal protein due to alpha-1 antitrypsin deficiency. In alpha-1 antitrypsin deficiency, the trypsin is accumulated in the liver, causing the cirrhosis. Even in the protein, the protein can be diffused normally in the kidney, that can be accumulated in the renal epithelial cells. Now coming to glycogen, usually seen in diabetes and glycogen storage disorders. Last but not the least is the pigments. Pigments may be exogenous or endogenous. Exogenous may be tattooing or the carbon pigment, which is called as anthracosis, which accumulates in the lung. The endogenous pigments are lipofuscin, which is a wear and tear pigment, accumulates in the heart, which is brown color. Melanin is black color, accumulates in the skin and mucous membrane in melanomas and benign nevus. The third one is hemosiderin pigment in repeated blood transfusions and hemochromatosis and in hemolytic anemias. And last but not the least is the bilirubin, which is a yellow pigment, accumulates in the sclera, which is seen in jaundice. Thank you. Yes.